Good evening and welcome to another episode of Easy Access to Healthcare for All. My name is Hussaina Amina Abuki. The new thinking in the NHIS is that no one should be left behind in attaining universal health coverage. Towards this end, the scheme launched a new flagship program known as the Group, Individual and Family Social Health Insurance Program, GIFSHIP. Our focus tonight dwells on the why and how this program is designed to give every Nigerian an opportunity to enjoy healthcare under a social health insurance cover. Details in the course of the program. First on the program is the news segment, where we bring you highlights of events around the NHIS. Top on the lineup, Health Minister inspects NHIS facility. And Executive Secretary of the NHIS charges newly employed health workers of the NHIS to be diligent in the discharge of their duties. This and more shortly.
Health Minister Osage Ehanire was on an inspection visit to the Monitoring and Complaints Center, currently under construction and being supervised by the National Health Insurance Scheme, NHIS. The center is being established as part of efforts to meet the mandate of ensuring that the services of the NHIS gets closer to the people through the use of modern technologies and enhanced data management. The center, when fully functional, will have its headquarters in Abuja, with 79 branches spread across the 6 geopolitical zones of the country. While receiving the minister at the center, the Executive Secretary of the NHIS, Professor Mohammed Nasir Sambo, said until now there has been unsuccessful attempts in the past to ensure full automation of business processes of the NHIS. He said the infrastructure, which is expected to be completed in the next few weeks, will help people gain access to the NHIS and will enhance efforts being made in ensuring global health coverage.
This project is something that will bring about seamless automation of the business process of the National Health Insurance Scheme, a situation whereby a prospective enrollee will stay from the comfort of their houses and enroll into the National Health Insurance Scheme. So all the bottlenecks and barriers that are there in the process of getting to go and enroll will be eliminated, so people can seamlessly join the National Health Insurance Scheme.
Also speaking, the project technical manager of the NHIS, Engineer Morakio Akinyola, said when the project is completed, people will not need to come to the NHIS offices for data management or lodge complaints, as they can do everything they need, including pre-registration for enrollment from the comfort of their homes.
When this solution is completed, there is no need for Nigerians to be coming to NHIS headquarters for data management, for complaint management. They can sit at the comfort of their home, make a call, and they will get resolution to their problem. And also, they can start registration from their mobile phone. When you finish the registration on your mobile phone, you just come to NHIS for biometric and iris capture.
Speaking at the occasion, Minister of Health Osage Ehanire expressed satisfaction with the coming on stream of the center and commended the NHIS for its efforts in this direction, saying that it will go a long way in achieving the goals of the universal health coverage.
From what I see so far, I'm impressed. It will be a great leap forward in the management of health insurance in Nigeria. So one of the problems we have now is health financing. And health financing is not just availability of funds and resources, but the management of funds. So the e-management of resources, e-management of financial processes will help a lot towards universal health coverage.
The Executive Secretary of the NHIS, Professor Mohammed Nasir Sambo, has said the recent recruitment of healthcare professionals is basically to drive the National Health Insurance Scheme towards attaining universal health coverage in view of the services they will add to the scheme. He was speaking in an interview during the last day of the 2 weeks training organized for the inductees.
With this recruitment that we have done and with the decentralization of activities, we will be able to be doing our work faster we will be doing our work efficient, and we will reduce a lot of cost in conducting our businesses.
The Executive Secretary spoke on some of the advantages the professionals will add to the scheme while speaking of their expectation.
The basic thing is we expect them to report to their various stations, and they acclimatize with the system. They are going to meet other people that are being on ground, and they will work together to see how they can deepen the activities of NHIS, as I have mentioned. They will be in the lead in the areas of accreditation, because you have many states within the National Health Insurance Scheme that have no single healthcare professionals, and these activities cannot continue in this manner.
The NHIS recently recruited 190 health professionals for each state of the Federation, comprising 2 medical doctors, 1 pharmacist, 1 lab scientist, and a nurse, making 5 professionals per state.
You're watching Easy Access to Healthcare for All, bringing you news and issues around the National Health Insurance Scheme. The NHIS has adopted a holistic approach towards attaining universal health coverage. One major tool it intends to use is the GIFSHIP program. What exactly is GIFSHIP? Who is it for? How do people benefit? These, amongst other questions, are answered in our next segment, Issues around the NHIS.
People get sick every day, and they need to visit a hospital to get health care. For a large percentage of Nigerians who do not have a health insurance cover, their sincere desire is for government to do something that will reduce the burden of out-of-pocket expenditure for health care.
Yes, if the government actually come in here to assist citizenry on health issue, it will be better for the country. One, because they say life, if there is no life, there is no quest for anything.
I don't know. It will be better if government can provide health insurance for the citizens, because it's not a good experience for you to go to the hospital and the amount demanded from you is very high.
Yeah, I need the government to take care of that, to make some efforts into that if possible.
It is in response to such prayers that the National Health Insurance Scheme was launched in 2006. Whereas employees in formal employment are enjoying the benefits of Social Health Insurance Program, attaining universal health coverage, which is the mandate of NHIS, will involve designing programs and packages that provide a cover for every category of Nigerians. It is in order to achieve this that the NHIS created a special social security insurance scheme to capture all Nigerians. This is known as the Group, Individual and Family Social Health Insurance Program, GIFSHIP. GIFSHIP is a health insurance program that is taken up and paid for by groups, individuals and families not covered by other NHIS coverage platforms.
You cannot achieve universal health coverage when you have the large chunk of the population not being integrated within the health insurance. That is why I discuss about the Basic Healthcare Provision Fund, an initiative of the federal government to increase the fiscal space to ensure that the vulnerable segment of the population also come into the national health insurance ecosystem. In addition to that, we now look at other segment of the population, the informal sector, an individual who is managing his own business, an individual who is managing his own business and his family. So if they are to be covered within the national health insurance system, how will they come in? That is why we muted the idea of developing a GIFSHIP program. It is supposed to be an all-encompassing program that will cover G, group of people, I, individual, and F, family, who are not employed within the formal sector, but they are either employees of the informal sector, or they are self-employed, provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
Before the introduction of GIFSHIP, the insurance program available to an individual was the Voluntary Contribution Social Health Insurance Program, VCSHIP. How did it fare? What happened to it?
That VCSHIP was designed to allow individuals to come and join the national insurance. So it was being experimented, but it was terribly abused by the enrollees. If you want to do a VCSHIP and you don't have a mechanism to control fraud, it will be destroyed. And that's exactly what happened in Nigeria. The VCSHIP was rolled, and people study the mechanism of action or the modus operandi of the VCSHIP program and began to abuse it. I talked about the principle of cross-subsidization, whereby people that are prone to ailments and people that are not prone to ailments are coming together so that there is cross-subsidy. The well person will subsidize for the sick person. That's how health insurance works. So in that VCSHIP program, people will just fold their arms until when they have a serious health challenge. Then they will go and pay 15,000 naira. And by tomorrow, they would have utilized their 15,000 naira and disappear. For example, a woman, she had a previous cesarean section, and now she knew that she has gone to the hospital and she was told that this pregnancy, you cannot deliver it, it has to be cesarean section. So she will quickly come to the National Health Insurance Scheme, register, pay 15,000, in 2 weeks' time or 3 weeks' time, she will be taken for surgery for cesarean section, which may cost about 120 or 100,000 under normal circumstances. So when she gets the cesarean section, she disappears.
GIFSHIP was therefore created as a more realistic program to safeguard against abuse through the introduction of checks and balances.
We said, okay, a waiting time of 3 months. So by the time, if for nothing, it gives us the time to do the administrative work. And once your name appears on the register, you can start accessing service. Though we are realizing that from what we are getting in the field now, some of the stakeholders are telling people that even when their names appear on the register, they'll still wait for another 3 months. That is not correct. And that is what we want to tell them. The waiting time is 3 months. It gives us time to do the administrative activities to bring the person on board.
For you to start accessing surgery, you have to wait for 6 months. So that funds that has come to the National Health Insurance Scheme would have accumulated. And without accumulation of fund, that cross-subsidization will not happen. You just put the money and you wipe it. But you put the money, you are building it. After 3 months, after 6 months, that fund has accumulated. So by the time some people will be sick, some will be well. So you will not use the money to treat those that are sick. And you are reaccumulating the money. Then other group of people who were well yesterday will come with sickness tomorrow. Then they have the money to utilize. That is the principle and ABCD of health insurance.
GIFSHIP was formally launched on the 26th of November 2020 by the Minister of Health, Dr. Osage Ohanire. The minister said a major objective of GIFSHIP is to rapidly expand the scope of healthcare coverage in the urgent quest by the Nigerian government to attain universal health coverage for which it cannot afford to leave anyone behind. Dr. Ohanire added that GIFSHIP offers citizens the opportunity to participate and benefit from health insurance.
GIFSHIP eliminates the known difficulties because it creates additional value by expanding and upgrading the VCSHIP for better reach, for better service quality, and for better user experience. Those who have closely followed the story of NHIS will not fail to note that this is a benefit of the enabling environment for productive work accruing from the peace and harmony that now reign in NHIS.
All the stakeholders in the health sector and from the legislature were in attendance at the launch to give their support to the GIFSHIP program created by the NHIS as its flagship for attaining universal health coverage. Exactly who is GIFSHIP targeted at?
The GIFSHIP program essentially is meant to provide opportunity for coverage for people outside the formal sector program. These are supposed to be individuals, private individuals who are on their own self-employed, contractors, businessmen, families from persons who are not employed, market women, cooperatives. Essentially, these are the people GIFSHIP targets.
To be more specific, eligibility and membership of GIFSHIP include small-scale enterprise with less than 10 staff, non-cohesive groups of persons such as associations, unions and institutions outside the organized private sector, self-employed individuals, families and groups, retirees and retiree associations, diaspora groups, foreigners living in Nigeria, adopted persons such as those paid for by members of the National Assembly and philanthropists, etc.
One of the appealing features of this program is, I know you are a rich man, and I know that you are a philanthropist, and I know that people have been disturbing you to pay for their healthcare services. Some will come and say, give me, my wife is going to deliver. They say it's operation and I don't have money. So this platform, it will help you as a rich and philanthropist man to come and say, okay, who are the people that are within my purview? I will get them all together. If they are 20, if they are 30, if they are 100, you register them under your own umbrella. So you have become a group.
GIFSHIP also provides a platform that can be explored to provide healthcare for retirees and the elderly.
There's a platform under GIFSHIP for retirees to come and join the National Health Insurance Scheme. And let me say that it's not the National Health Insurance Scheme that is paying for them, but it's a deliberation that ought to be done to see how that money can be realized. And an international organization can come and say that we are working on geriatric, we are working on elderly, and we have money, we have funds to pay for healthcare for elderly. So those elderlies who don't have any means of income can benefit from such program.
In order to register for GIFSHIP, the contribution rates are 45,000 Naira per annum for individual subscriber. The subscriber may add 2 direct dependents. Family will contribute 60,000 Naira for 4 biologically related persons. Each extra dependent of a family will be enrolled at 15,000 Naira. 10 persons shall be the minimum number of persons in a group, except small-scale enterprises with less than 30 employees. Group enrollment is at a contribution rate of 15,000 Naira per person per annum. These rates are subject to changes as may be determined from time to time by the NHIS. Benefit packages of GIFSHIP shall be provided across the 3 healthcare levels, that is, the primary, secondary and tertiary healthcare levels, and are similar to what every other enrollee of the formal sector program has. There are, however, some exclusions.
Exclusions are usually terribly chronic diseases, like cancers, like advanced kidney diseases, which will have a component of dialysis that will just cover some few sessions. because if we say that, somebody in dialysis will have to go for life, and if he contributes 15,000, he's going to benefit for life. It's not realistic. So you will get some initial, session. Then you have to also complement it.
The success of GIFSHIP to serve Nigerians well as a social health insurance vehicle that will drive Nigeria towards universal health coverage lies a lot with the enrollee, who has a responsibility to protect the program from abuse.
He needs to, understand the program so that he knows his expectation and his limitation. He has to do that. Otherwise, he will just be complaining on something that is not within the 5 years. He also have to ensure that he maintain regular payments to entitle for services. Number 3, he must have a self-restraint and think that if this program is destroyed, it's not going to be beneficial to him, neither will it be beneficial to his family. So all safeguards that will guide against abuse and misuse should be entrenched into his mind.
Thanks for staying tuned. In our Stakeholders Corner this evening, we are featuring Dr. Enabuchi Chidi, the Head of Clinical Services at Sokoro District Hospital, Abuja. Dr. Chidi shares with us his thoughts on the introduction of NHIS in Nigeria by the federal government.
Well, the introduction of NHIS in Nigeria was a very welcome development because it made it possible for many of the citizens to access care, even in facilities that they thought they would never be able to. And so this has increased the number of people that have access to quality health care in the country.
One thing the NHIS has done in recent times is to initiate a reconciliation between HMOs and healthcare providers. Dr. Chidi shares his thoughts on this initiative.
It's a welcome development, and I believe the NHIS is trying to make sure that the facilities are not owed after offering service to their patients, to their clients, which is what has been obtainable in the past. And it's a good development, and this is encouraged so that all the loopholes will be covered and whatever is being owed will be settled amicably, and the facilities will be happier to offer services to Nigerians that are registered under the scheme.
Dr. Chidi also has a piece of advice for the new management of the NHIS in order to aid its drive towards universal health coverage.
Dialogue goes a long way, and discussions, meetings. So I think the new leadership should find a way to meet with the facilities offering care under the scheme and the HMOs. They sit down and table the problems that have been found and find the best way to solve these problems.
That was Dr. Enabuchi Chidi, the Head of Clinical Services at Sokoro District Hospital, Abuja, speaking on the NHIS and healthcare delivery in Nigeria. We will now take our last segment of the program, your questions answered. Please stay tuned.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Question: how can a child above 18 benefit from NHIS?
They can continue enjoying
under what we call the extra dependents. You pay the sum of 15,000 naira and you continue to access services under the father or the spouse, or the mother, all right? Then the person can either join the university. If you go to the university, you now join what we call the tertiary institution social health insurance program, we call the GIFSHIP in the schools. Or you can join our latest program we call the GIFSHIP.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
You too can send us any question about the NHIS. We'll do our best to get a response from the relevant quarters. Until I see you again next week, do have a good night.